India's at a pretty exciting point with huge potential. If you look and say in the world, what can we do to raise people up to middle income levels or reduce poverty? India's it. Not only because it's 1.3 billion people, but because it has a dynamic democracy, it's got a lot of native talent, and so even the countries that are behind India will be looking to say, okay, how can you manage this feat? China, of course, for the last 20 years was the economic miracle. I mean, it's amazing. They are a middle-income country, and of course, we don't just want to look at economic figures, we want to look at equity as well. And although in terms of democracy they score very poorly, their focus on poverty reduction, on equity issues, actually has been very impressive. In fact, they have a plan to take the final 43 million that are very, very poor and use income policies and cash payments to solve that. So, in some ways they're a model, and in some ways they're not. But if India over the next 20 years can achieve a 7% average growth and do that in an equitable way, that's a miracle for the country and a miracle for the world. And I think we all want to help make that happen. The question of what are the enabling factors that might hold that back, something that should be talked about a lot. The two that I think are most prominent to me are education, which I'm not an expert in. Our foundation applauds everybody involved in that, but in India, we're not a player there. Health, including nutrition, is the area that we've spent 75% of our money, and even the other things we do, the agriculture, the sanitation, they're all but the digital money piece kind of ties back into this dream of good health. And definitely the Indian health picture is a glass half full. The improvements over the last 15 years, adopting new vaccines, the death rates have come down very substantially. And it's wonderful to have been a partner to a lot of those things that have had a very, very good effect. But the health levels relative to the income level already achieved is far lower than it should be, particularly in areas like nutrition. And maybe we made a mistake. We always talk about deaths, this many kids die, and that is a very important measure. But maybe we should have always put along with that the health of the living, because after all, now we have, even in India, 94% of kids do survive into adulthood. And yet a lot of these disease episodes and lack of nutrition are determinant in terms of their capacity. And we probably should do more work on mapping that numerically to the physical and mental capacities, and therefore what that economic effect is. But there's no doubt that all sorts of tests and things show that fixing these health problems, the cost of doing that can be very modest. Yes, it may involve going from 1.5% of GDP on public health to 3%, and it involves improving the quality of those systems. But if you take other economic miracles, like, well, all of them, mostly Asian, they all had that kind of, they lowered their malnutrition and they invested in health. And so, I'd say health is more on, people are talking, admitting that there's a malnutrition and a sanitation problem. I'd say the last several years, that's good. Now, we need to talk more about, okay, exactly what's missing, how do we solve that problem?